Okay. Good morning, afternoon, and evening, everybody. Welcome to the Engagement mHealth SIG webinar. Oh, sorry, I've got some stuff going on my screen. The webinar has been put together by the mHealth SIG attached to ISBNPA. You can see the SIG team written down below, so there's a lot of people who have helped to make this happen. I just want to say, if you want to get in contact with us, our Twitter hashtag and our current email address is also down below. Okay. I'm going to start just with a little bit of housekeeping and then introduce the topic for the SIG. So we are recording the webinar. You should be able to access it eventually on the ISBNPA homepage via events. We'll also be re-airing the website in a week or two. So if you miss out on asking your questions today, you're welcome to jump back on and ask them later on. To ask questions, there is a Q&A box. We're going to leave all the questions to the end in a Q&A session. So just write your questions as they come up to you in that box, and we will go through it and ask the presenters your questions at the end. That's a good thing to do, so that if you have a burning question, you can get it out and continue to listen without trying to remember it. In the Q&A, if you can also raise your hand. You have a slightly different screen to us, but I think you only have 3 buttons, so it should be all fairly straightforward. This is just a little bit of shameless self-promotion. The mHealth SIG has been on a paper writing extravaganza over the last year or so. The 2 papers down the bottom are already published or accepted for publication. They're really an overview of the field. The final paper, which is relevant to today's presentation, is currently under review, and it's all about measuring engagement. It was really informed by Olga's systematic review, which we'll talk to you a little bit today. And it's really about trying to be a primer to help people measure engagement and think about all the different ways that can be done. So it's really more of a how-to guide with a critique of what's currently available. So if you'd like to know more about that, you can email or send us something via Twitter. So we have 2 presentations today. I'll introduce each speaker before they come, but we have Olga Perski and Associate Professor Mitch Duncan. And we'll also have our SIG chair, Maher, who's going to help us moderate the discussion. I will introduce them as they come, I think. Okay, so just a quick introduction from me, and then I'll let the speakers have their turn. Engagement in our field, at least in behavioural science, is still somewhat in its infancy. We all really have different ideas about what it is, and I think you'll find that as you're listening today. I think it has the interest in it has emerged out of non-usage attrition, so a lot of people feel like engagement is a behaviour, it's about usage. But borrowing from other disciplines, we also think of it more as a psychological process. So Olga will go more into that, so I won't steal her presentation. But yeah, keep in mind about thinking about engagement and maybe a different way to what you have before. There's been several models. These are just 3 examples. One that has kind of synthesized the literature and accumulates them is Olga's model. I've put the brief reference there, so you should be able to go to the recording and look those up. And these have been really helpful, at least, because they do differ a little bit in what they predict. But useful for testing hypotheses about how to actually influence engagement, and most importantly, why we would care about it and how it would impact on efficacy, which I think we need to keep in mind as the point as to why we really care about engagement in the first place. But obviously, in order to test these models and test hypotheses, we need good measures of engagement, and we need to start actually exploring how engagement links to efficacy. So that's really what the focus of the webinar is going to be today. Oh, that's the end of my screen. So I'll just start by introducing Olga. So Olga is a final year PhD candidate at University College London. Under the supervision of Professor Susan Mickey, Professor Anne Blandford, and Professor Robert West, Olga's research is focused on the conceptualization, measurement, and promotion of engagement in digital behaviour change interventions. So it's a real pleasure to have her to share some of her thesis work with us today. I'll hand it over to Olga.
Great. Thank you so much. Let me just start sharing my screen here. Okay. So yeah, thank you so much for inviting me to present some of my research here today. So really, so I'd like to acknowledge my team, of course, over at UCL. Today, I'd like to talk you through some of the work that we've been doing on trying to come up with an operational definition of engagement. So the first bit of my talk will be quite theoretical, so hopefully I'll keep you engaged in that. And then the second bit, a little bit more practical, talking about the development of a self-report scale to measure engagement. So just to give you a bit of a background, so engagement with behaviour change interventions is considered necessary for them to be effective, and this is really assumed because there's been evidence for a positive association between engagement and successful behaviour change across a range of studies with various characteristics. However, we don't really have a shared understanding of what engagement is, and as Camille pointed out, there's a plethora of existing definitions and measures both within disciplines and across disciplines, and this hinders scientific progress because we can't really aggregate data from multiple studies. So the aim of my doctoral research has really been to gain a better understanding of how to define and measure engagement, and then also to identify factors that promote or detract from engagement. So like I said, the first bit of the talk will be around how we went about trying to define the construct of interest, which is not actually very easy. And then the second bit around how we can then go about measuring it. So I think this quote quite nicely kind of describes the process of trying to define a psychological construct. So there's not really a precise method that can be used, and the theorizing process is necessarily going to be a bit intuitive. However, Mackenzie and colleagues helpfully pointed researchers towards a few different questions. So if we try to address these in the process, we can sort of hopefully gain a little bit more clarity as to what the construct really is about. So the first question that we can ask is, what's the conceptual domain? So is it a feeling? Is it a behavior? Is it an outcome of a behavior? To what entity does it actually apply? So does it apply to people or to a specific task or a process? Thirdly, how stable do we think that the construct is expected to be over time, and also across different situations? So is it more similar to a trait or a state? And then finally, what are the necessary and sufficient conditions for something to be an instance of the construct? So in order to address these questions, we drew upon two different data sources. So the first one was a systematic review of 117 articles from the behavioral science, health psychology, computer science, and human-computer interaction literatures. And articles were included if they provided either an explicit or an implicit definition of engagement. And then the second data source was an empirical think aloud and interview study with a group of smokers and drinkers who were interested in quitting or cutting down using an app. And we prompted them to think about what it feels like to be engaged with a smoking cessation or alcohol reduction app. So really, I would like to talk you through kind of the key findings from these two studies, and then think about how we can use these findings to address the 4 questions, and then come up with kind of a working definition of what engagement is in this context. So in the systematic review, the definitions could broadly be categorized into two different groups. So the first group of definitions focused on the subjective experience that arises during the momentary interaction with a piece of technology, characterized by focused attention, intrinsic interest, and enjoyment. And the second strand of definitions conceptualized engagement in behavioral terms, focusing on the extent of technology usage, adherence to the intervention, and also exposure to critical intervention content like key behavior change techniques. And the systematic review also helped us look at how engagement is linked to other key constructs, and helped us sort of generate a conceptual framework of how it's linked to these other constructs. So this model is quite busy, and I'm not going to talk you through all of it, but really the key point here, if you can see my mouse, hopefully, is that engagement seems to be influenced by the digital behavior change intervention itself, so its attributes, so things like behavior change techniques, but also the way in which these techniques are delivered influence engagement. But also the context in which the intervention is used and characteristics of the people using the intervention will influence engagement. And thirdly, we also found evidence that the target behavior influences engagement. So if we think about smoking, for example, it's either been found or expected that someone who relapses back into smoking or someone who successfully quits smoking are both equally likely to disengage. So that's quite important to keep in mind. So now going to the qualitative study that we conducted. So just to remind you, so this was what people feel like when they're engaged. So our participants highlighted feeling drawn in or sucked in by an engaging app. And they also described that feeling engaged is quite similar to feeling interested or stimulated, or feeling enjoyment or pleasure. So these findings kind of nicely corroborate those from the systematic review in terms of the subjective dimensions of engagement. And then also participants highlighted the behavioral aspects of engagement, so wanting to use the app over and over and again. So in terms of addressing these four questions, so I think in terms of the conceptual domain, these two data sources led us to conclude that engagement actually spans across three different domains. So it's both a behavior, it's a cognitive state, and it's an emotional state. In terms of the entity to which the construct applies, these two data sources weren't actually that helpful in trying to decide whether it's task specific, meaning that the DBCI needs to be present for someone to be engaged with it, or whether it's perhaps person specific, so that an individual is likely to engage similarly with a DBCI as they are in other kinds of situations, like a face-to-face conversation. But for the purpose of kind of moving forwards with the research, we hypothesized that engagement is task-specific. But I'm very happy to discuss this if anyone wants to after in the Q&A. And then in terms of stability over time, so going back to the conceptual framework that I showed you, there's quite a lot of research that engagement responds to kind of technology and person-specific attributes, which seems to be more similar to a state rather than a trait. And then finally, specifying the necessary and sufficient conditions for someone to be engaged wasn't very easy either, but we tried to use logical reasoning to determine these conditions. And we ended up with 2 behavioral indicators and 3 experiential indicators. So the first behavioral indicator is amount of use. which refers to the time spent using the intervention. And the reason why this is seen as a necessary condition is that evidence shows that what's known as lurking in online discussion forums, which basically means that you're passively using the intervention but not actively contributing content or inputting information, but that's linked to successful behavior change. So it seems that passive rather than active use seems like a more lax criteria, and therefore that's considered necessary for engagement. The second behavioural indicator is the depth of use, and this was considered necessary to determine the intensity of engagement with the intervention. And that's because independent behaviour change techniques have been found to be associated with behaviour change, so therefore it seems quite important to be able to determine which components or which behaviour change techniques people have in fact engaged with. So we may then ask, why aren't these two behavioural indicators sufficient for engagement? And I think that's because we can quite easily imagine someone displaying evidence of both of these two indicators, and then it's not necessarily the case that they've actually paid attention to the content, which therefore means that they probably weren't actively engaged. And therefore we added these experiential dimensions. So the following experiential dimensions seem to be also necessary. So attention, interest, and enjoyment. And again, the final one, enjoyment, I think that's what's indicated by the literature and the participants in the qualitative study. However, I think we can think of counterexamples where someone is paying attention to something, but they're not actually enjoying what they're doing. So again, I think we can discuss this later as well. But so our working definition of engagement is that it consists of these 5 different indicators, 2 behavioural and 3 experiential. So the next step was then to think about, okay, we've got this working definition, how can we then go about measuring it and also testing its validity? So we considered quite a few different instruments. So the first one is automatically recorded usage data, so looking at screen views and timestamps. And although this is an unobtrusive way of measuring engagement, it's uncertain to what extent it actually captures people's attention or interest. So we therefore decided against this. The second one might be direct observation. However, this is, I mean, even though it's likely to be quite accurate, it's obviously not feasible in large-scale studies. So we didn't go for that. The third one we considered was using some kind of psychophysical measure, so like a wearable device or a portable eye tracker to measure attention or the emotional indicators. However, this is quite obtrusive, expensive, and not particularly feasible in large-scale studies, so we didn't go for that. And that left us with a self-report scale. And even though it can probably be argued that this is quite burdensome for participants, there were some key benefits. So with the self-report scale, we would be able to measure the 5 different indicators of engagement. And then also another key benefit is that in large-scale studies, this would actually allow researchers also to look across different apps, for example, without having access necessarily to the back-end data. So we wouldn't necessarily have to be in close collaboration with the developers in order to access the data. So that's what we decided to go for. So now I'd like to talk you through the development process and then some of the very, very early findings from the validation study. So we started off by generating an initial pool of 18 different items, and these were scaled using Likert scaling where possible. And then we conducted an online content adequacy task to test the scale's content validity. And here are two examples of some of the items. So we decided to go for the sort of question sort of tapping the intensity of the state rather than getting participants to agree with statements. So how strongly did you experience pleasure, or how much time do you roughly think that you spent on the app? So in the content adequacy task, we recruited two different groups. So a group of non-experts, and they were recruited through Amazon's Mechanical Turk, and then a group of 20 experts in behavioral science or human-computer interaction. And they all completed the task online, and they were asked to classify these initial 18 items into one of 6 categories. So it was the 5 purported dimensions of engagement, and then an unclassified category. And at least 70% of respondents had to correctly classify an item for it to be retained. So here are some, here's an example of the results. So we've got 5 items here tapping interest. And as you can see here, highlighted in blue, only 2 items reached the a priori threshold in both groups. We also had an item here, fascination, which reached a threshold in the expert group, but not in the non-expert group. And then it seemed like both groups had difficulties with negatively worded items. So it might be the case that terms like boredom or indifference aren't actually seen as the polar opposites of interest in everyday language, or it might also be the case that participants didn't quite understand the task instructions despite quite extensive piloting and were unable to distinguish between the two. However, we could move forwards for validation with 10 items. So these 10 items then formed a scale with sufficient content validity. And the scale has now been administered to a sample of adult excessive drinkers, and they're all residing in the United Kingdom. They're interested in reducing their alcohol consumption, and they've all voluntarily downloaded the Drink Less app onto an iPhone or iPad. And these participants were all prompted to fill out the scale after their first login session, as we wanted to capture the initial state of engagement. So what happened was that people, when pressing the home button on their smartphone, they'd get a local push notification with a link to the scale. So in terms of the scale validation, what we're hoping that this methodology will allow us to do is to look at the scale's construct validity. So whether a 5-factor solution with 2 behavioral and 3 experiential factors provide a good fit of the data. Predictive validity, so whether self-reports of initial engagement predict re-engagement, so future logins. Incremental validity, so whether a model including these extra experiential indicators actually add predictive power to a model including only the behavioral indicators. Also looking at divergent validity, so whether engagement is actually conceptually different from theoretically related constructs such as flow, but then also importantly, whether or not it's even feasible to measure engagement through a self-report scale. And so I'm currently in the process of analysing the data, so I wasn't going to share too much of that today, but I did want to share some early findings that I think can probably help us answer the question about feasibility. So here is a flow chart of the recruitment period. So we stopped at the 24th of January, and during the recruitment period, as you can see here, we had quite a large sample of eligible users. However, as you can see over here, less than 4% were actually willing to fill out the scale. So I think that kind of tells us that it's not looking too well in terms of feasibility. Obviously, it might allow us to to gain some other insights in terms of construct validity and predictive validity. However, it doesn't seem feasible for use in real world settings. So just to conclude, I think this systematic approach to defining the construct has led us to a working definition of engagement, which suggests that it's both a behavior, a cognitive state, and an emotional state. However, measuring engagement through a self-report scale may not be feasible in real-world settings, and it might be the case that such scales are more useful in the early stages of development, such as during usability testing. And in terms of future research, I think it's really, really important that we identify existing or come up with new ways of measuring engagement in real-world settings. So thank you very much.
Thank you, Olga. That was wonderful. We have one question already. If you have any more questions for Olga, please put them onto the chat now. Oh, we have some in chat. Okay, great. I'd like to introduce Associate Professor Mitch Duncan. Mitch is an academic at the University of Newcastle in Australia. He holds a future fellowship from the Heart Foundation. He's conducted many evaluations of web and mobile interventions, looking at physical activity, sleep and diet, and predominantly focuses on sleep and physical activity now. I'll hand it over to you, Mitch. If you can.
Okay, thanks, Cam. Just let me get my slides up. Okay, so you guys can see that now? All right, thanks for the introduction into kind of some of your work with engagement, Olga. I think it kind of fits quite nicely into addressing some of the shortcomings of engagement that we've seen, or that we've typically used, which is just purely those metrics from the website or the app that we are easy to collect, but as you say, may not actually capture engagement in its fullest form. So I'm going to be talking with you today about looking at how engagement, and in particular different patterns of engagement with a web-based physical activity intervention may impact on behaviour change, and also how social cognitive factors in a very broad sense might actually influence that. So I won't go into what is usage or engagement, but I guess typically we would see a lot of studies saying that a higher level of engagement is broadly associated with greater behaviour change, and that recently, including some of the work by Olga and Cam and quite a while back now also, is that there's different patterns of usage. And this is something that kind of first really struck me with some of our work on 10,000 steps and an early project called Man Up, where you can see down here in the bottom the number of, or the proportion of users who were logging in, actually going in and making a self-monitoring entry in this study, which was trying to promote physical activity and healthy eating for middle-aged men, dropped off quite rapidly across the first couple of weeks of the study. And it was quite heartbreaking to see that at first, because you invest so much time in these interventions trying to get them up and running, and then you see that people at a quick glance don't use them. But what you see when you dig into the data a little further is that there's these distinct patterns that emerge. Is you've got these people who kind of continuously use it at a very low level. You've got people who kind of are almost these one-hit wonders who come in once and never come back. And perhaps these people have got different needs in terms of what they want or expect from the intervention. And I don't think kind of we adequately capture that when we just look at the average number of logins or anything like that. So I wanted to delve into that a little bit further with this particular study. So apologies, this is kind of busy, but this data is from the Walk 2.0 trial, which, as you can see there, has got a large number of people involved with this study. But I'd also like to thank Camille for some of her thoughts on this work as well, and also Stina Oftedal, who's working with me and currently undertook the analysis, or part of the analysis that we'll be talking about today. So in broad terms of what the Walk 2.0 study was it was a 3-arm randomized control trial where just over 500 adults were randomized to either a logbook condition, which was just pen and paper, the Web 1 condition, which is how we referred to the existing 10,000 Steps website in this particular study, or an enhanced version of the 10,000 Steps website that included some more social interaction features. But key to both of those those intervention conditions was the ability for people to actually log on, record the number of steps that they took each day, and get graphical feedback, set goals for those behaviours. And that was consistent across the two groups. If you'd like to read more about kind of the differences in that, please check out the main outcomes paper, but just in the interest of time, I'll kind of leave the description of the intervention there for the moment. In terms of what we'll be dealing with today, it's really the data from baseline to 3 months. This is both to preserve a little bit of power in the sample size, but also to provide some comparison back to studies that would typically examine usage over a 12-week period as well. In terms of who was in the study, predominantly female, middle-aged, so fairly typical of what we see in our interventions there. But of interest to this particular presentation today, the time spent in moderate to vigorous intensity physical activity was measured using a waist-worn accelerometer. We captured usage or engagement with the intervention platform using the website databases, and we classified people based on the number of self-monitoring entries that they made each week. And for the purposes of today, we classified those as 1 or more self-monitoring entries a week. We also asked people about their attitudes towards physical activity, their intentions towards increasing activity, and how confident they were that they could actually increase their level of physical activity also. So just in terms of the main outcomes from the study, just to provide a little bit of context, we see here that the Web 2 group, so the enhanced group, increased their physical activity from 0 to 3 months. There was no change in the Web 1 group, and there was obviously a significant difference there between those two intervention groups at 3 months. And that's really the time periods that we're looking at in today's presentation. For the current analysis and presentation today, we tried to examine the usage patterns that we see in this data using a data-driven approach using repeated measures latent class analysis. So that the aim of that was to try and identify mutually exclusive groups of different usage patterns using that repeated weekly website data. And for that analysis, we examined, as you might with, say, factor analysis, a number of different solutions where we kind of started with a 2-class solution right up to, I think it was 6, and then tried to find the best fit both in terms of the model fit and also the interpretability of the solution. We examined the relationships between usage patterns and participant characteristics using the multinomial logistic regression, and we examined differences in physical activity by these usage patterns in an ANCOVA approach adjusted for intervention group and baseline activity. So in terms of what we found, first of all, because there was 2 different intervention groups, we examined the latent classes separately for each group. And what you can see here is the proportion of people in each of the 3 different classes that we found in each different intervention group. The 3-class solution provided the best fit and was kind of the most interpretable, so that's the one that we went with. And you can see here that we've got a group of consistent users, we've got a group of what we termed non-users, and also a group that we termed the drop-off users. And these labels are purely descriptive. And because the proportions of people in each of these classes were quite similar, and the actual patterns over time in the intervention were really quite similar between the 2 groups, we decided that just to simplify things, that we would examine the usage classes or patterns in a combined group, or collapsing the 2 intervention groups. In terms of what that looked like, you can see here our 3 groups in terms of their engagement with the intervention over time. And so the blue line is our consistent users. So they really got in there every week, logging their data quite consistently. We had our group who were who we labelled drop-off users. But that's probably a fairly harsh label to give these people, because they did really stick around there till week 7 or 8 of the intervention. And I think in most eHealth or mHealth interventions, you'd be reasonably happy with that level of engagement, rather than in some of our studies where it can be quite short. And then we've got what we labelled the non-users, which is, they just kind of quite a low level of usage. And again, that might be a harsh label to assign to these people, but relative to the other classes, they were definitely much lower than that. And I think to try and better understand who are these people in these different usage groups, and that's why I examined a couple of sociodemographic factors, also baseline activity, and some of the psychosocial factors to see, well, what are the characteristics of these usage groups. And so the drop-off users were more likely to be female relative to the consistent group. And that's probably a little bit in contrast to some of the other findings out there in the literature, where females might be more likely to continue to engage with the intervention. And so I think that's something that we could perhaps explore to see if that similar trend emerges in other data sets that we've got. And younger people were more likely to be non-users as well. But interestingly, things like education, baseline activity weren't associated with the usage group here, which I guess was somewhat unexpected. But really what I would like to get at is, and understand more, is, do these usage patterns matter in terms of behaviour change? And this is something that I think, it's really the first time we've attempted in any of our studies to get a better handle on these different types of usage patterns that emerge, and also how they are associated with behaviour change or may impact behaviour change. So in terms of what we saw here, so we've got our consistent users here. So this is their activity levels at 3 months. And we saw significantly higher levels of activity in the consistent users in comparison to the drop-off users and the non-users. So it was about a 6-minute per day difference for both of those groups, but there was no difference between the drop-off users and the non-users. And I guess, as I said, that's quite interesting for me to have a look at. But I certainly, I guess I don't think that, that this speaks to the need to get everyone at a consistent level across time of usage, because individuals are going to vary in terms of what they need from the intervention and what they hope to get from it. So what we also did with this study with this particular analysis, was to examine, okay, well, how does this matter? Does usage group matter when you also look at some of these social cognitive factors also? And what we saw was that when we look at the interaction between these, I guess, these psychosocial factors and the usage patterns, that there was no significant interactions across any of these variables examined, but there was the relationship or the differences in activity still remained for the usage patterns, and also higher attitudes and intentions were associated with higher levels of activity also. So not unexpected there in terms of those associations. But I guess what was unexpected was that, if you think about people having different needs and wants from the intervention, is that, perhaps some of these factors might or should interact with usage patterns and have a differential effect on physical activity levels. And then, so when going back and looking at some of this data from the study, I think that whilst it was good and that we had, a relatively large sample of people, we had objective measures of physical activity, they were a very motivated group to actually increase their level of physical activity. And this kind of shows out, if you look at the percentages across time. So this is just the number of people making a self-monitoring entry over time. So this is the data that we use to derive the latent classes. So you can see it was quite high. And overall, there was, people were logging, if you to look at the frequency of the number of days that they logged their steps, it was really 4 days out of 7. So I think that's quite high in both groups. And also, we may have suffered from some ceiling effects here with the psychosocial variables where, they were starting to max out, average ratings of 4 out of 5 in that. And so that may have impacted our ability to see some of these associations in this particular data set. So just to wrap up and kind of give you my thoughts on where I'd like to take this, is obviously what we used as indicators of engagement here were quite narrow, and I think it would be quite interesting to start to bring in, as some others have done, some broader measures of engagement. Perhaps also some of the data from Olga's self-report instrument, and that's kind of the advantage of latent class analysis, is that it can bring in all these different types of data sources. You're not really limited to using a particular type of data. Also looking at this in the context of some of our multiple behaviour interventions. So we've currently got a couple of physical activity and sleep interventions underway at the moment, where people are logging their physical activity and sleep. Is there different usage patterns for those types of behaviours? So people logging one behaviour versus both, and does that impact on their change in one or both of those behaviours? Also, as I said, looking at how this type of approach to quantifying usage patterns might differ across different interventions, where we've got some differing levels of engagement to the relatively high level that we saw here. And also kind of, working towards some of these, integrating this with some of the broader frameworks of engagement, so taking into consideration a broader range of factors. So that's a very quick summary of this work that we're doing here with trying to quantify engagement and the different types of usage patterns that exist in the data. And I'm looking forward to trying to get this approach replicated in some of these other studies as well. So I'll leave it there, and hopefully we've got time for some questions if we have any. Thank you.
Thank you very much, Mitch. That was great. We have a lot of questions. I might just quickly share my screen so that we can have our Twitter hashtag back up in case anybody wants to continue the conversation later. Oh, except now I can't see the questions. 1 second. I'm going to scrap the unsharing.
Yep.
Okay. Okay, great. Okay, we have a lot of questions here. I will start with this one is the first question that we got. So I'll start with you, Olga. Do you think the definition of engagement can be generalized in different contexts? For example, for different health behaviours, smoking versus physical activity, and different population groups, so those for the general population versus, say, disease populations?
Yeah, thank you. So that's a really interesting question. So I mean, the first one in terms of different behaviours. So I think sort of using a sort of behavioural science approach where I suppose the intervention can be sort of described in terms of the behaviour change techniques or kind of active ingredients. I think it would generalise across different behaviours. However, what's a little bit less certain is probably whether, or the extent to which it generalises to different populations. So kind of, for example, people with cognitive decline. So I think this is actually something we probably should look into more. So whether or not things like attention is required for engagement, then I suppose it wouldn't necessarily generalise. Yeah.
Okay, Mitch, do you have anything to add to that with your multi-behaviour change steps? Okay, Olga, can you say a little bit more about how and when the scale was presented for the feasibility study?
Mm-hmm. Yeah, so I mean, so we were interested in kind of the first login session for two reasons. So the first one is that quite a lot of evidence suggests that people there's a very steep drop off after the first login session. So we were kind of trying to see whether we could discriminate between people who log in again or not based on their level of engagement in the first session. So that's why it was presented directly after the first login session. However, the level of accuracy, I suppose, I mean, because people would download the app, go through the registration process, and then have a go at using the app, and only when they press the home button, that's when the push notification would be delivered. So I suppose that's how it was delivered.
Yeah. Do you have any thoughts, and this relates to a question from Ben Smith, I think one of the biggest problems that we have in the research world is that a lot of people that we want to know how they perceive the intervention drop out from the study completely. And so obviously trying to get them in the first session is a good idea. Have you had any thoughts about how we might be able to capture some of that psychological data from people who are unwilling, or if you could do the questionnaire again, would you do it differently? Would you try and embed it? Have you had any thoughts about how we might get that self-report data?
So I mean, it's obviously very early days, and I think kind of something to keep in mind is probably also that so it was administered in an app setting, and I think what we know from research into apps, which seems to kind of quite nicely actually reach theoretical saturation across multiple qualitative studies, is that app users are quite impatient and quite unlikely to want to fill out anything extra. So it would be interesting to see how this kind of measure would perform in a website. So for example, in the intervention presented by Mitch here, So I'm not quite sure what my prediction would be. We might get some higher response rates. But then in terms of how to improve it, I mean, we try to include as few items as possible. So I suppose 10 items for 5 dimensions is probably as low as you can go. But then I think, so potentially the factor analysis results from this study might be able to tell us whether or not those indicators are actually strongly correlated, and maybe we might be able to remove further items and just maybe use one measure of attention, for example. Yes.
Olga, I may have missed it. Did you hit people again with the opportunity to fill it out, or was it just a one-off on their first login?
So it was just a one-off because we wanted it to be, we want to be able to check against the objectively recorded usage data to also look at the criterion validity. So sorry, I didn't actually mention that. But yeah, so they weren't actually given another opportunity. And the way it works on iPhones, as I'm sure most of you know, is that now if you don't kind of delete a push notification, it lands in your notification center. But in the analysis, if the kind of timestamp for filling out the questionnaire is significantly different, kind of if it's not within the same day as the usage data, then they wouldn't be kind of included in the analysis. So yeah.
Okay, thank you.
Oh, Olga, hi, I'm Carol Maher. I'm here to help Cam field the different questions because it's kind of intense trying to watch the speakers present and keep an eye on all the questions that are coming in. Just following on from that, we have a question from Chris Lynch, who commented about, by measuring engagement after the first session, are we actually going to be capturing the same kinds of issues that Mitch highlighted in his presentation, which is, that usage is changing over time. So do you have a comment on, or do you have any data looking at how sort of engagement, and particularly those things like enjoyment and attention and so on, that aren't captured through usage statistics, do you have any sense of how they're changing over time?
Yeah, is that for me? Sorry.
I think either of you.
Yeah.
Mitch, do you?
Yeah, I mean, we've broadly we've got these measures at each time point there, so the psychosocial factors as well. And so I guess we could look at those. The next step might be to look at, say, changes in those constructs in relation to the usage patterns. And yeah, I think that might shed some light on it. I am a little bit concerned about the potential ceiling effects that we might see, that there might be quite limited room to move with some of these factors. But I do
only down.
Yeah, which is not great if you're trying to improve those things. But yeah, it's certainly something that would be quite interesting. And I think someone asked about changes in activity in the drop-off group. There was a slight change from baseline. I'm just trying to pull up the data now and stall a little bit while I find that information, so I might come back to that.
Mm-hmm.
Okay.
You go ahead, Cam.
This is probably something Mitch might want to comment on as well, but some of the models talk about the idea that we can still be psychologically engaged with the intervention without using it, I guess. So we might think about something we've read and that's still influencing our behaviour, and that we shouldn't think of those people as disengaged from the intervention. And so how do we, and Mitch, you kind of talked about that in a sense of people's needs. So how do we differentiate people who just drop off because they're dissatisfied, or versus the people who are still engaged but maybe have what they need or don't really feel the need to use it anymore?
Yeah, it's a great question and a great dilemma for us to try and deal with. In short, I'm not sure of how best to do it. It might be that perhaps that we can start to build some of these very brief measures into almost our baseline data collection, or kind of if people are using the app, like almost like some kind of satisfaction or something with it. But I think it's going to be really tough to measure, because as we saw, with what Olga presented and some of our own work, it is really tough to get people to fill out additional questionnaires outside of the app. And so, yeah, I think that's really what we need to better understand this. I'm just not sure of the most efficient way that we can actually capture that. Sorry.
Olga, have you thought about, once you've looked at how your brief measure performs, trying to develop or see how it compares to things like, the smiley versus the frown face as a very brief proxy measure of how people are experiencing the app or the content?
Yeah, I mean, so that's not something that we've looked at. I suppose that could be tested in the future. I suppose just commenting on what Mitch was just talking about in terms of trying to sort of distinguish between people who sort of disengage because the intervention wasn't suited to them, or because they kind of stopped doing the target behavior, or because they successfully did the target behavior. And I think that's something, just thinking about potential ways where that question could be answered. So I'm wondering, in the area that I work in, which is more related to addictive behaviors like smoking and drinking, I suppose in the physical activity domain, there might be a slight advantage where you can quite easily measure the target behavior using accelerometers. So I'm wondering if there's maybe an opportunity there to try and use potentially N-of-1 methodology, and kind of try to get quite stable baselines, and then look at what happens if you try and kind of manipulate things within the intervention, and whether or not people respond in terms of engaging with the app or the website, and what happens to the behavior that's unobtrusively measured. So that's kind of just a thought there.
Mitch, I have a question for you. With the analysis that you did, where you did the latent class analysis and found kind of the three groups of users, and you were able to relate that back to sort of socio-demographic and baseline characteristics. Have you, or are you aware of any other studies that have been done that have actually taken those groups and tried to explore their needs further, like in terms of trying to work out, with those people who are dropping off, why is it? And with the people who, never engaged well from the beginning, why is it? And how do we change our interventions to better meet their needs?
Yeah, short answer is no. I'm not aware of anyone who's actually gone back and kind of, I guess, retrospectively tried to figure out why these people did that. There's been a few studies that have done kind of similar to what we did. What are the baseline predictors of that? But yeah, no one that's actually made the effort to go back. And I guess you need to kind of finish the intervention period, or be kind of actively monitoring usage along the way to, I guess, get in and get those people and get their information.
Yeah, and actually that gets me thinking, so much of the time when we do studies like this, running the study is our focus, and then we often don't have a lot of time or resources to really delve into the data set afterwards. Yeah, and particularly say adding on an extra sort of process analysis, where we go back to participants to find out more from them. And I just think we would learn so much if we could arrange our studies in a way that we have, the time and resources to do that stage well.
Yeah, it'd be fantastic, wouldn't it?
So just to add to that, if possible, so I'm actually aware of a few studies that have done that in RCTs, and I can't think of the author right now, but the take-home message, I think, is what happens in terms of trying to triangulate. So in our group, for example, we've done quite a lot of qualitative research, and I'm sure that, well, I know that Cam has also done a lot of research looking into trying to develop things, trying to take the user's needs and values into account. And then I suppose the other side of things is retrospectively going back, asking people what kind of went wrong. And I think what's quite interesting is that if you look at what people kind of predict about themselves, they're saying that, you know, things that kind of increase their motivation to do the target behavior, that's going to be really important. The app or intervention needs to be really interesting. But then retrospectively looking at, you know, what made them drop out, it's actually contextual things, more to do with, well, I didn't have time. So they don't really seem to match. So I'm wondering if we can maybe try and triangulate using both of those approaches and sort of build a better picture of what's actually going on. That's not only looking at introspection, I suppose. Yeah.
Yep. Thank you. I think we have time for one more question. This is from Ben Smith. He points to the fact that one of the main reasons to looking at engagement is to see whether it's, you know, predictive of efficacy outcomes. And in that sense, he asks if enjoyment is relevant, because people might, may not necessarily enjoy using it, but they'll keep using it and benefiting from it. And I think that you've spoken about that a little bit, but I think it also raises for me what it is that we think the psychological aspects of engagement are doing to increase efficacy. Is it just because they drive usage, or is there something else around persuasion? Like, what is the mechanism for the reason that they influence the behavior change process?
So I think, I mean, what's really interesting about that kind of in terms of whether or not people benefit from the intervention, which I suppose could be interpreted in multiple ways. So it could be in the way that we researchers would look at things, whether or not they actually achieve the target outcome, or if the participant or user is actually feeling better. And I tend to refer to that as kind of the reverse causality hypothesis, which means that these kind of long-term users are actually, I mean, they might be the type of people who kind of are engaging because they're doing better. So the intervention might not actually be, in a sense, causing them to change their behavior. And I really think this is a key thing, that we need better kind of experimental paradigms enabled to separate sort of the causal link between engagement and effectiveness. And I haven't got a magic solution for that, I'm afraid, but hopefully we'll be able to think of something.
Thank you. It's I think it's really good to have you here as somebody who primarily works in addictive behaviours, to unsilo ourselves, to have you and Mitch both experience in different aspects has been really wonderful. So thank you for agreeing, you and Mitch both, to present in our webinar today. We're a little bit over time, so I think we better call it quits there. Do you and Mitch want a final comment, or?
Thank you so much for having me. It's been really, really great. Thank you.
Yeah, same here. Thank you so much for the invitation and the opportunity to present.
Thank you. So to people whose questions we didn't get to, or those that I maybe slightly changed on the fly, I do apologise. Again, there'll be a recording of the webinar, and everybody, Mitch and Olga are both on Twitter, so I'm sure they'll be happy to continue the conversation about engagement further. So thank you, everybody.